Good morning. Of course, I'm Judge Paul Lilly, the County Judge of Brown County. I want to speak to everybody this morning to tell you what I learned when I was at the Operation Warp Speed Summit this past Tuesday up in Washington. There were many states represented, primarily the states that were experiencing the largest number of positive tests, and of course, unfortunately, the largest number of fatalities. And while we're only a county of a little over 38,000 as of yesterday morning, we had lost 47 lives that had, by the definition, been attributed to COVID. So that puts us among the highest per population in Texas. Not the highest, but we are certainly in the upper category. And as I'll mention in a few minutes, I got to some one-on-one time with Governor Abbott, and he knew that. He's got the numbers memorized in his head, and he knew exactly how many lives we had lost. So Brown County is a priority to him, which I'll discuss in a few minutes. Also, of course, the president led the meeting, the summit. The vice president was there, and then there were 4 governors from the most affected states that were there, absent California and New York. But Texas, Governor Abbott was there, and he made himself available to anybody from Texas, anyone from Texas, all 254 counties. He wasn't going to leave until he visited with everyone. Now, there weren't representatives there from all 254 counties, obviously, but he did make sure that he took the time to answer all my questions, which I'll convey to you today. As you've seen on television, prior to yesterday, Texas was not for certain what vaccine we would be getting, but the last 24 hours have been you talk about Operation Warp Speed, things have been moving at warp speed. As you know, yesterday, the representatives within the FDA voted to approve, I believe the vote was 16-4, to approve what the EUA for the Pfizer vaccine. Now, the Pfizer vaccine is what we'll be getting in Texas. That is the vaccine that must be stored at almost 100 degrees below zero. We, as taxpayers here in Brown County, should not be out any money to store that. It should arrive in its own containers to keep it at that temperature beyond the time that it will take for us to disseminate it. Also in attendance, in addition to Governor Abbott, was General Perna, and I hope I'm pronouncing his name right. He whispered it in my ear, and that's what I remember. General Perna is a 4-star general with the Army, and President Trump appointed him the chief operating officer of Operation Warp Speed, and his primary task is logistics. What I learned at the summit, what I learned from Governor Abbott directly and from General Perna directly, is that the vaccine is already, of course, it's continuously being produced at the facility, the Pfizer vaccine, but it's also that which has been produced is being stored strategically, and it is ready to ship upon immediate formal authorization from the Food and Drug Administration. What we're waiting on, the EUA you heard me mention before, is called an emergency use authorization. And we're hoping that will come today. It could have come as early as yesterday evening, but they didn't vote on it yesterday, or they didn't approve it yesterday evening. We expect that it will be approved today. The FDA, the director of the FDA was there at the meeting, and he spoke. I got to visit with him as well. And he did say that by close of day Friday, he fully expected the EUA to be approved. Now, what will happen once that's approved? General Perna and Governor Abbott have guaranteed me that once that EUA is received, is approved, within 72 hours, not 72 days, not 7 weeks, but within 72 hours, we will have the vaccine here or in any of the 254 counties that need it. It will be in Texas, and then it will immediately be placed on trucks and shipped. So essentially no further than we are from Austin, San Antonio, and Fort Worth. We expect to have it within 72 hours in the county, delivered to our health authority. Now, our Brownwood Brown County Health Authority has been urging our retirement centers to sign up for exactly how many doses of vaccine that they desire, and that's critically important because they're going to be one of the very first to get it. First, of course, will be healthcare workers. Second is public safety, and almost equal to second, they call it third, but almost during the same time frame will be those in our retirement facilities. And I'm not sure, I hope to hear back from the health department, but I haven't as to exactly how many in the county had signed up. I don't have that number for you today, but I'm sure if you contact Lisa Dick, the director, that she would have that, be able to provide you with that information. They spent over 2 hours talking to us at the summit about or answering questions that we had and speaking to us about the research. And I know that's the primary concern here in Brown County. And I know that we've become divided into two camps, or not really divided, but categorized into two camps. Those who desire the vaccine and those who don't feel it safe and do not want to take it. And I want to explain to you, I want to state unequivocally that nobody in Brown County, absolutely no one, and as far as I know, no one anywhere is going to be required to take the vaccine, period. It's entirely a personal choice between you and your healthcare provider. And shortly I'll tell you exactly where that you'll be able to get the vaccine once it gets here in Brown County. It is true, for those who have concerns about the vaccine, it is true that normally a vaccine of this nature takes 8 to 10 years to research, develop, and hit the market for distribution. However, in this case, as President Trump said, we're in the middle of a national pandemic, something we haven't seen since polio, the measles, and smallpox, and we just cannot wait 8 to 10 years to see what the long-term effects of the vaccine are. All of the experts, all of the MDs and PhDs and all that have worked on it, and the director of the FDA spoke on their behalf, feel that there will be no different long-term effects than, say, the flu vaccine. That's what they anticipate. However, of the almost 50,000 people that have been, not quite 50,000, but almost 40, in the 40,000s, I want to say 49,000 something, but don't quote me on that. There have been very few serious reactions to the vaccine. Most people reported soreness, just like getting a flu shot or any of the other inoculations, a little soreness in the arm, a little redness, but an overwhelming number didn't report any other side effects other than that. Now, those who suffer from severe allergies, I want to speak to you directly. You need to contact your healthcare provider specifically, and you all make an educated decision as to whether or not you should take the vaccine. Again, for those who are absolutely certain they do not want it, that's fine. No one's going to compel you to take it, ever. Now, the vaccine is going to be, the president also enlisted the two largest pharmaceutical distributors, and that is Walgreens and CVS. We have 2 CVSs here in Brown County and 1 Walgreens. They will also, in addition to healthcare providers, they will be providing inoculations for those who choose to take the vaccine. Now, this is something I want to make very clear. The vaccine will cost no one anything. It is absolutely free. It has been paid for by public money. So the vaccine itself, you will not be charged for. So if you go to CVS or Walgreens as of Tuesday, they did not plan, according to their representatives, to charge any type of administrative fee or anything for the time it takes their personnel to issue the vaccine, to give you the inoculation. They understand we're in a national pandemic, and they were committed to getting as many people inoculated as possible. Now, your healthcare provider, your private healthcare provider, can charge you an office visit or what they call an administrative fee to provide you with the vaccine. If you have the wherewithal and that's the route you want to go, and you want to visit with your healthcare provider before you take the vaccine, which I strongly encourage everyone to do to make sure that you have none of the allergies discussed, then you would need to make an appointment with your healthcare provider and get the vaccine through them. Just be aware, though, they can charge you an office visit. I'm hoping, I'm issuing a heartfelt plea to our healthcare providers in Brown County. Help us get as many people inoculated who desire, of course, as soon as humanly possible, and worry about the administrative fee later. Again, let me give you a time frame. Once the EUA is approved, we should have the vaccine here in our county within 72 hours. Now, it'll be another 72 hours after that. It'll take us to disseminate it to the various healthcare providers and for CVS and Walgreens to get set up. Now, they announced that they will also be issuing the injections by appointment only. You can't just show up and expect to be inoculated. So they're not taking appointment times yet. As soon as the vaccine gets here is when that will begin. And again, the vaccine will be delivered on the West Coast by FedEx, or the western half of the United States by FedEx, from the center west all the way to the West Coast, and the center east all the way to the East Coast will be by UPS. Now, I understand that Brownwood, speaking to Governor Abbott, will fall within, because we're kind of directly in the center. If you draw a line down, it'll basically split Texas in two. As I understand it, the western half of Texas, we're still included in the FedEx range. So that should be who will be delivering it. FedEx and UPS have explained to us that they have hundreds upon hundreds of wide-body jets standing by to pack to the brim with the vaccine and fly it here is just as quick as they can get it here. Of course, the order, of course, of inoculation is healthcare providers first, then public safety personnel, and then our senior citizens, whether they're in a retirement center or not. That's the order that we hope, and then the general population. Now, that may sound lengthy, but it is not. That will move just as the summit, the operation itself is called, that will move at warp speed, at lightning speed. So within essentially 1 week of the vaccine arriving here in Brown County, a vast majority of everyone who chooses to take the inoculation will have access to it. It will happen that fast. Now, the Pfizer vaccine is a two-part vaccine. The first inoculation will give you anywhere from 80 to 85% immunity from the virus, and then the secondary vaccine, which you should follow up 20 to 30 days later with the second inoculation, that will put you up to 95%. Now, there is certainly no 100% fail-safe vaccine yet. There's not even one that's in the works that will guarantee that you cannot catch the COVID-19 after you've been inoculated. But overwhelmingly, it should give the vast majority of us immunity. I've been asked whether I'm personally taking it. I promise you, after sitting through 2 hours of research, and which you can all find online, and speaking to some of the doctors who were involved in the trials, I do plan on personally, I've made the decision that I will be taking the COVID-19 vaccine. Again, whether or not you take it is entirely up to you. That's pretty much what I have to tell you today. I wanted to let you know that as soon as the EUA again is approved, they'll be on planes within 72 hours, some within just hours. The closer you are, of course, to the distribution center, the sooner you'll get your vaccine for the less time that it has to travel. Texas, we're quite a ways away, but Governor Abbott guaranteed me that within 72 hours it will be in the state. Randy, do you have any questions?
No. Okay, so the distribution points in Brown County would be CVS and Walgreens or your doctor's office?
Or your healthcare provider,
okay.
Yes.
All right. But no mass gathering like, say, at the Coliseum?
Yeah, at this point in time, that is not planned.
Okay.
And we don't plan on having any drive-through inoculations. If the demand is overwhelming, that's something that we'll set up,
okay.
By all means. And we have the ability to do that. We just, this has happened all at such quick speed, we don't really know exactly how many people of our 38,000+ are going to want the vaccine and how many parents are going to want their children vaccinated. So within the first 72 hours, again, of getting here and people starting to make appointments, we'll have a much better understanding of how many, and then we'll also have a much better understanding how many more doses that we need to request.
Okay.
And of course, our Brownwood and Brown County Health Department will be in charge of disseminating the vaccine once it arrives here in the county. hopefully, I've given you basically all the information that I have. Again, I urge you to make a personal decision as to whether or not you want to take the vaccine or not. But I want to stress to you, you can watch the summit online as well, and look at the research online. In closing, I simply want to stress that our best physicians, our best scientists do not fear or do not anticipate that any long-term effects would be any different than that of the flu vaccine. And again, we're in the middle of a national pandemic. We haven't seen anything like this since polio or smallpox. So we don't have a decade to wait. We just simply don't. We have to act now, in using President Trump's words. So we're going to make it available to you, the citizens of Brown County, the residents of Brown County. Just as soon as it gets to our hands, we'll start getting it distributed to the inoculation points. Right. Anything else I can answer?
No.
All right. Thank you.